welcome Dr. Julie Gerberding, Executive Vice President and Chief Patient Officer, Communications, Global Policy, and Population Health at Merck, and Cerner Board of Directors member.
I am so pleased to welcome you to the 2021 Cerner Healthcare Conference. It's a privilege to greet you on behalf of my colleagues on the Cerner Board of Directors and our new board chair, Mr. Bill Zollers. Of course, we were hoping to be meeting in person, but the coronavirus had other plans for us again. So we appreciate your leadership, your resilience, and especially your support for our heroic frontline healthcare workers and the patients they serve as we cope with this pandemic. Unfortunately, I'm not a stranger to infectious disease outbreaks and the kind of havoc they can create. In fact, my entire career started on the front lines of the AIDS pandemic when I was just a young intern at UC San Francisco. And since then, my career has been punctuated by new and emerging infectious disease threats at every step of the way. At San Francisco General Hospital, we face MRSA, VRE, drug-resistant tuberculosis. At CDC, we confronted anthrax, West Niles, SARS in 2003, avian influenza, mad cow disease, and many other threats. And of course, now at Merck, I've been challenged with nosocomial extensively resistant gram-negative bacteria, the Ebola outbreaks in Africa, and a whole variety of complex animal health infections. Now, the infectious disease outbreaks of the past don't match the scope, scale, and impact on lives, on communities, and on societies that we've been experiencing these past 19 tempestuous months. But local or global, brief or prolonged, infectious disease threats are constant reminders that our health system is absolutely integral to emergency response and population health. So if I'm certain about one thing, it's that infectious disease outbreaks happen and will likely to continue to do so. And we must invest more resources, more talent, and leadership attention on preparing for these inevitable threats. And that, of course, includes investments in robust health data systems that improve decision support and make it easy, or perhaps even joyful, for clinicians to provide the kind of care that their patients need and deserve. Crisis is always a crucible for innovation, and Cerner has proved that point in collaboration with many of you in the past several months. I'll just highlight a few of these innovations, but I'm sure you'll hear about many more throughout the conference. So Cerner joined with Amazon Web Services to provide access to de-identified patient data so health systems and academic researchers could conduct epi-studies and clinical trials of promising COVID-19 treatments. In Philadelphia, Einstein Healthcare Network enlisted Cerner's help to help run an open source model to find patients at highest risk of COVID complications so they could proactively intervene with these vulnerable people. Cerner also made its mass vaccination software readily available to clients to help accelerate access to vaccination, which was especially important during the early phases of vaccine launch. And Cerner also helped equip clients to take advantage of telehealth tools and emerging technologies that supported this. The company even helped implement field hospitals and surge locations around the world. So there are many other examples of innovations supported by Cerner and initiated by its partners over the past many months. But suffice to say that we've learned a lot and hope we can apply these lessons learned in the time of crisis to more rapidly and effectively solve problems for patients and their providers during less challenging times. Of course, that kind of innovation opportunity requires leadership, and I'm absolutely delighted to introduce you to the newest leader of Cerner's fantastic leadership team, Dr. David Feinberg, who officially assumed the Cerner CEO position on October 1st. It's impossible to spend more than 5 minutes with David without being captivated by his absolute belief that health technology is the key to helping clinicians provide better care and well-being for patients and for healthcare organizations to achieve better clinical, financial, and organizational outcomes. His stellar career trajectory from academia and health system leadership at UCLA to president and CEO of Geisinger, and then VP of Global Health at Google, assured the Cerner board that Dr. Feinberg has the breadth and depth of organizational leadership experience, the requisite health technology knowledge, and a track record of successful innovations that would inspire Cerner's associates to achieve new solutions, contribute to improved patient care and outcomes, and sustain Cerner's long-term business success. So with that brief introduction, I'm delighted to welcome Dr. Feinberg and look forward to his remarks. Thank you for joining us, and thank you for all you do on behalf of our patients and our health system.
Please welcome David Feinberg, Cerner President and CEO.
Thanks for the warm welcome, Julie, and your insight as we continue to work through this global public health crisis. First, let me thank all of you for joining us here at Cerner Health Conference. As you can see, I'm recording my first CHC talk from our near-empty Innovations campus here in Kansas City. But let me assure you that our 26,000 people around the world are as focused as ever on helping you improve the lives and health and well-being of the communities you serve. This CHC theme, One Patient, One Community, One World, from my perspective, is appropriate for a few reasons. First, it captures the spirit of togetherness that we've all adopted during this strange time. The pandemic is both a personal and a shared experience. We're relying on each other more than ever before, even while we've been asked to stay further apart than usual. Our theme also really defines how we at Cerner think about transforming healthcare. Our job is to make sure caregivers around the world have the right information to get their communities back to health. We do that by keeping the patient at the center of everything we do. And finally, this idea of one patient, one community, one world describes my personal journey to Cerner. And I'd like to share a little bit about that path today. Now, as it relates to the keynote addresses, I feel like it's only fair to tell you up front, I have very few grand announcements to share. The truth is, I'm recording this about a week before you see it, literally on my third day at Cerner. But I've been a student of healthcare for nearly 30 years. I've used Cerner technology in a clinical setting. I know firsthand both the promises and the frustration of this digital age of care delivery. So I'd like to give you a sense of who I am, what I'm passionate about, and some of the things that I think we can accomplish together. I also want to discuss areas where I think Cerner needs to focus in the near term to make your life easier. I'll use our CHC theme, one patient, one community, one world, along the way. So let me start by introducing you to one patient. His name is Willie, and I first met him at age 4 while I was starting my career as a child psychiatrist at UCLA. He was diagnosed with autism, and his family was told Willie would likely never speak. Last month, my wife and I were invited to Willie's sister's wedding. Willie was there, now age 32, looking handsome and in a tuxedo. Oh, and by the way, Willie was not only there, he officiated the wedding. You see, he did learn how to speak. The idea to officiate came from his sister's fiance. Willie, my patient, gave me an amazing feeling of accomplishment. Patients like Willie are why we all got into healthcare. After UCLA, I joined the Geisinger team in central Pennsylvania. I was hoping to learn the payment side of things since Geisinger had a long history of integrated care and payment. I did learn about insurance, and that's a story for another day. But what I also learned, but wasn't expecting to, is what you can do if you love your community. The small rural towns in central and northeastern Pennsylvania grew up together with Geisinger. Patients and families didn't know about Geisinger's national reputation. Rather, they knew that's where they went for care and caring. Every one of Geisinger's innovation was done for one simple reason. It would help the community. Geisinger became a payer to make sure community members would have access to care that they could afford. While I was there, we created the world's largest biobank of whole exome sequencing, not because we cared about DNA, but rather we knew that in that DNA was information we could use to keep our community healthy. The same with the fresh food pharmacy that provided meals to type 2 diabetic patients and their families so that advice like diet and exercise could actually be achieved. The one world experience was what I just witnessed during my time at Google. Our YouTube COVID information page had 500 billion, yes, billion impressions. The team worked incredibly hard to make sure authoritative information about COVID symptoms, vaccines, side effects, and other information was available to the world. Each of those previous work experiences has something in common. From my earliest clinical days at UCLA, and all the time and effort spent building Geisinger's system to improve community care, to the global reach and technology of Google Health, healthcare is about people caring for people. You may not realize, but this is actually the second time I've spoken at a Cerner Health Conference. The first was in 2016, and the world has changed a lot since then. But in some ways, little has changed. For many, healthcare is still broken, unaffordable, biased, and largely still based on acute care health rather than prevention. COVID showed the world what's wrong. Not enough focus on public health, prevention, and equity. Social determinants play too large of a role in our healthcare and mortality. But we in America remain focused on fee-for-service instead of fee-for-value, where incentives would push all of us upstream. As I've shared, healthcare is people caring for people. Now that care can be in a formal setting, or as simple as a parent caring for a child at home, or for that matter, the self-care we all do for ourselves. When we get it right, when we focus on one patient, one community, one world, then things like hospitalizations are seen as failures of outpatient care as a failure of home care fundamentally as a failure of caring for our communities. Although I've only been on the job a couple of days, I'm encouraged by a few examples of Cerner working with you to reduce those failures. We do that by making sure that the information is available to the right people at the right time to make the best care decisions. Last year, for example, Cerner worked with the Department of Defense, Veterans Affairs, and the U.S. Coast Guard to create a single common health record for American service members and veterans. That health record starts when those men and women enter the military and continue throughout the rest of their lives. In using this joint health information exchange, now more than 60,000 medical facilities can securely access complete patient records of service members and veterans to provide the best care possible. We all know the promise of healthcare technology is to identify ways we can improve care that otherwise might be missed. For instance, a few weeks ago, we published from Dr. Paula Cowan from the NHS. Dr. Cowan wrote about using data science to support people with learning disabilities. Did you know that people with learning disabilities have a life expectancy 25 years lower than the general public in the UK, or that those with learning disabilities are at greater risk for hospitalization with the flu? Dr. Cowan's team used Cerner's Healthy Intent to understand that a learning disability diagnosis was the leading contributor to increased risk for hospitalization, more than 2 times that of COPD. From there, they hosted flu vaccination clinics specifically designed for patients with learning disabilities and their primary at-home caregivers. In the end, 92% of those identified at high risk were vaccinated. People caring for people. If you tuned in or attended recent CHCs, you know we're also taking the appropriate steps to combat the opiate epidemic with toolkits and opiate management workflows. Now we're using AI and machine learning to take the next step in fighting this battle. Our new tool identifies patients at risk for developing opiate use disorders before they present. Here in Kansas City, the predictor tool is live at University Health and is being validated at 3 other organizations. Of course, healthcare in the United States involves more than just care delivery. Being current on complex and changing payment models, staying on the right side of a razor-thin margin is a difficult task even for the best managed health systems and provider organizations. One thing I've heard plenty about is how important it is for Cerner to improve our revenue cycle solution. By the time you see this talk, we will have announced our new Revelate patient accounting offering. In caring for people, we need to make healthcare more affordable and understandable. We need to simplify billing for patients. That starts with making billing more integrated and seamless in your organizations. And we think Revelate will do just that. This morning, you heard from Dr. Gerberding about why Cerner reached out to me to consider joining this healthcare company. So I'd like to tell you the rest of the story, why I chose to come here. To me, the best way to have a meaningful impact on healthcare is by working with people determined to build and use technologies that improve the lives of others. Cerner, and frankly other EHR companies, have done an incredible job of automating processes and digitizing medical records for more than 40 years. In itself, that's a huge accomplishment. It started with Neil Patterson's clear-minded vision for what healthcare should look like. But we haven't fully reached our potential. Digitized records, for one, need to be usable. They need to be measured by how they enable caregivers to spend even more time at the bedside and less time at the terminal. Improving the usability of Cerner solutions is the top of my list of things to get done. Let me give you an example. Banner Health this summer worked with Cerner to improve their intake form so their nurses could spend more time helping patients and less time documenting. The work's going well, and we're on track to save 9,000 hours and eliminate 10 million clicks every year. That translates to Banner caregivers spending more time with patients. While Gartner has recently acknowledged Cerner's work in this area as an effective tool to tackle clinician burnout, and we have scaled the use of this essential clinical data set to more than 100 organizations, we still have a long way to go. But usability is just the beginning, not the true promise of the digital age. If healthcare is people caring for people, then our job is to provide caregivers with the tools that allow them to do their jobs. Records should help patients avoid unnecessary tests and medications because the record is so easy to find and understand. Records should help nurses and doctors avoid errors and suggest what treatments might be best. Records should allow all of you to understand the health of your community, who's at risk, and what interventions are working. Records should predict. Records should help the world avoid or at least minimize the effects of the next pandemic. And all of this works only if we share your records with everyone you tell us to. If we use your records to improve your health, it can also improve the health of your communities and ultimately our world. Look, having cancer sucks. But what makes it even worse is having to navigate the nonsense of our health system at your most vulnerable moment. One of those things is beyond our control, but one isn't. Neil Patterson's wife, Jeannie, said something profound when she and Neil were fighting their battles with cancer together. It's the noise in the healthcare system that will drag you down, she said. That noise she referred to as having to know when your last colonoscopy was, instead of your doctor having that at their fingertips. It's spending 7 hours in a reception area waiting for lab results. It's having me, an MD, MBA with decades of experience as a doctor and running hospitals, yet not being able to make sense of an explanation of benefits of my healthcare from my own health system. That's all noise. And we need to change our mindset. We need to celebrate zero and work to eliminate all of that from the experience that none of us actually signed up for of being a patient. Like I said, I've been on the job 3 days now. In that time, a lot of people had asked me, my vision, what's my vision for Cerner? Where do I want to take Cerner? To me, it's easy. In the 5 years since I last talked at CHC, there have been some amazing medical breakthroughs. 2017, gene therapy is used to cure a teenage boy of sickle cell disease. That same year, FDA approved smart pills. They alert users if they've already taken their medication. In 2019, Google shows that artificial intelligence can detect lung cancer more accurately than radiologists with 8 years of experience. And last year, a COVID vaccine was researched, developed, and deployed almost 4 years ahead of the normal timeline for a new vaccine. But still the noise remains. That's what we have to take to zero. Our technology needs to be reliable. It needs to be understandable. It needs to be complementary. It needs to enable, not disable. So the vision of using data to do more great things even faster hasn't changed. That's the brass ring. But to achieve that vision, fixing the EHR is job number one. The pipes are late, which is wonderful, but we have to make it easier to get the right information to the right people at the right time to eliminate that noise. In my first note to my colleagues at Cerner last week, I told them I want to do great things together. It starts with staying focused on what's right for patients, and by extension, what's right for clinicians. You all have a role in this, of course. And so I'm asking you to be part of celebrating zero, along with all of us at Cerner. Thank you again for attending CHC, and I look forward to meeting many of you in the months and years ahead.